Dear brothers and sisters, there are always humanitarian efforts being made in Armenia. Some are on an emergency basis, such as those in Artsakh. Some are relatively new, and some are well established. All are vital, and the Knights and Daughters of Vartan have always played a significant role in supporting them. Today, we are proud to present a longtime medical doctor among our ranks that has been a leading provider in the Armenian Eye Care Project. He will update us on some of the many projects and efforts happening. Please welcome Dr. John Hovanessian.
Thank you, Dr. John. Thanks very much. I think that's for the nice introduction, and I want to thank you, and I want to thank for making all the arrangements for today for both technical and scheduling and everything else. It's a pleasure to join you. So I see the media and who did. I'm John Hovanessian. I'm an ophthalmologist who practices here in Orange County. And I've been involved with the Armenian Eye Care Project since almost its beginning, which was 1992. And we're going to talk today a little bit about kind of two aspects of the Eye Care Project. One is its origins and history and what we've achieved with some facts and figures, which I think are really impressive. But also about the human side, because I think to all of us, it's the individual connection. If you've been to Armenia, you feel a connection to the place and to the individual people. We have many, many connections like this to individuals there, and we've had the benefit of, we've had the opportunity to help. The Eye Care Project was born out of initially a call for help from the Minister of Health of Armenia back in 1992. That time, there was what he described as a wave of blindness that was occurring in Armenia. And that wave of blindness was the result of just a healthcare system in crisis because of an earthquake, of course, that happened in 1988, war with Azerbaijan that started that year and has continued really with aggression until this year, as well as independence from the Soviet Union, which economically caused challenges for Armenia that are, still we're still arising from. Roger Hovanessian is the founder of our project, has been its inspiration, has been the idea man from the beginning. And the success of the project, most of the credit certainly belongs to him and his energy. But it's really been a system of people who've been involved. And we'll talk a little bit about those people and what they've been able to achieve. And as we move forward into the next 30 years of the Eye Care Project, we have strong ideas on how we can continue this effort that was, while started by one person, will continue to be the efforts of many. So the first trip was in response to that fax from the Minister of Health in 1992. And Roger went on a fact-finding mission. He soon began recruiting other doctors to join the team because it became evident it was a very advanced disease. On that first trip, he tells the story of a little boy who was injured in the war. He went to pick up something shiny that was in the field that had been placed with mines, and he blew up in his face, destroying both of his eyes. Thank God he survived, because it was quite a blast. But he came to the hospital where Roger was, and after some conversation with the parents and explaining the situation, the boy was crying, and Roger asked, "Why is he?" Because he didn't understand. And it was because the boy thought that Roger brought new eyes from America, and we were going to be able to. That's not a technology we have. So there are many sad cases, but there have also been many, many where we've been able to make a difference. 100 volunteer physicians have now come to Armenia over the years. 60 different separate medical trips have been made. All doctors who come to Armenia pay their own way, without exception, their own travel, and manage all their own expenses. And so committed, you'll see some of the individuals involved. Many non-Armenian physicians continue to come to us because blindness is not about your race. It's not about the country you come from. It's about humanity. And fighting blindness is a mission we all share. So Roger kind of started, and Rick Hill was one of the first volunteers. Rick was a glaucoma specialist at UC Irvine. He came because Roger recruited him to help one little child who had glaucoma from birth. And Rick not only treated this child, but many, many, many others. He kept long, long hours in the operating room under conditions that were really less than ideal. In those days, very limited equipment we had. It was Soviet equipment. Some of it, you couldn't get parts for anymore, and so it was really jury-rigged with all kinds of clever ways to keep things going. If I had to use one word to describe how the success of the I project has come about, that would probably be Jarvi Mutu, which is, as we don't know, cleverness and resourcefulness, a word that really doesn't have an equivalent in English, but Jarvi Mutu, and also God's help. God has certainly looked out for us and what we're doing and made it possible for us to be successful. We've been able to get tremendous support from the eye care industry. Every company in the industry, we've begged, we've borrowed, and we've stolen equipment, supplies, medications, lens implants through the years, and it's been tens of millions of dollars worth of supplies that come to Armenia at no cost or a very, very reduced cost, so that we can benefit the people there. Now, people ask, how did I get involved in the eye care project? Because I told you it started in 1992. My first trip to Armenia was 1995, but I didn't know of the eye care project. There was no eye care project. We didn't call it that. It didn't have a name. I lived in Michigan. I was in my residency, in the middle of my residency, still training in ophthalmology. And I went to Armenia with a group that was organized by the Eastern Diocese Church. It was a young professionals group to go meet other young professionals in similar professions in Armenia. And so in advance, I called the hospital, and this is 3 years into Roger's work there, where he had been going for a few years. And I said, hello, this is Dr. Hovanessian. I'm looking forward to coming to Armenia, and I'd like to visit. They thought I was Roger. They're already interested. So yeah. And they said, oh, Dr. Hovanessian, we look forward to your visit. Nice. I didn't know who Roger was. So I traveled to Armenia. I came to the hospital, and they had arranged for me this very nice, thinking I was Roger, this very nice reception with food and music and drinks. And I thought, how nice these people are. And as I walked in, they said, who are you? And I said, I'm Dr. Hovanessian. And they said, you're not Dr. Hovanessian. I said, I'm not.
It's more hair than you do.
That's right. Never mistaken for each other. So I learned who this guy was when I lived in Michigan. Just a couple of years later, I came to California to report to UCLA to do a fellowship in front of the eye, 1 year surgery. And my cousin Madeline Aratelli, who lived in Moody Mills, called me and said, I need to meet a friend of mine. He's an ophthalmologist in Orange County. His name is Roger Hovanessian. I said, who is this guy? He came and met Roger, and we instantly were like-minded. And he allowed me to join him on his next trip, and since then I've been involved. And it turned out 2 years later that his practice needed someone with cornea training, and as an Armenian and a cornea specialist, I was a shoe-in, so I got it up, and I've been with Harvard Eye Associates ever since. And involved in the eye care project as part of the package. We realized early on it was impossible for us to treat every patient. It was not. There's no way we could meet the capacity of 3 million people. And so building capacity was important. Building capacity with local doctors needed to give them training from the West, because one of the problems we faced when we showed up in Armenia on our first trips was that they practiced a different kind of medicine in that part of the world. I would describe it as eminence-based medicine. Here in the West, we practice evidence-based medicine. There's science that is done to test hypotheses to prove that a treatment works. And then we incorporate it into our treatment programs. Their eminence-based medicine is, if your professor is eminent enough and he says something is true, it becomes true. And the dogma is the way we treat this. And so we had to change the way treatments were done without offending those who were in the medical system. Thankfully, we had some very, very cooperative leadership there who allowed us to take some of their brightest doctors and bring them to the US. Another theme of the eye care project that I think is just run through over the years is that I'm so proud that we have not failed in any major initiative that we've taken on. And when you talk about all the potential barriers to operating a project 10,000 miles away, all the uncertainties of bringing people to the US to train, that they might stay in the US, they may not want to go back, there's so many ways it could go wrong. And I think that's God's help. I really think that it's God's help that He guided us to the right people. But Armenian, Karakeshish, Lil Bostan, Armin Vartan, Anna Hovanessian, this is Lilith again, are in oculoplastics, glaucoma, retina, cornea, front of the eye disease, the leading doctors in Armenia today. They're doctors who we brought more than 20 years ago to the US to take fellowship training programs at University of Rochester in New York, UC Irvine, also UC Irvine, and at Proctor Foundation, UCSF. And they went and trained with the leading doctors. And I'm going to show you the next step in that in just a second. So doing that, these doctors went back and started subspecialty clinics, much as we have here. So if you've got a glaucoma problem, you're seeing somebody who just treats glaucoma. So you have the very latest in surgery, the very latest in thinking and the way we address disease. The same for all the other specialties that that may or may not be familiar to you. But we reached primarily those who were in Yerevan, right? There's 3 million people in Armenia, about 1 million of them live in Yerevan. So 2/3 of the population can't afford to and are not likely to get to Yerevan for treatment. So with that problem in front of us, we recognized around 1999 that we needed to reach out. We needed to be in the community for people like this. So the idea of a mobile eye hospital was born. It started with the gift of it cost about $1 million to develop it, and God gave us a gift of $1 million from a donor named Greg, who was a patient of our associates who left his estate to us, and that made this possible. Over the years, this project, this mobile hospital is still on the road today. It's still operating today. Every day when the roads are open, it can't operate always through the winter. It is screening patients. There's a large tent that goes outside, and we work at a local hospital screening people, and then people who come actually into the truck are those who need surgery, because we're operating laser rooms and other treatment rooms all within this facility. We've screened 500,000 people. We've treated 30,000, whether it's surgeries and lasers. We've distributed 70,000 pairs of eyeglasses. Everything that we do on this mobile hospital is free of charge. Nobody has ever paid a dollar for the care that they get. That's actually true in essentially all of our operations that we do. So, and if you want to be inspired when you go to Armenia, there are many places you can go. Probably not anything that's better than standing outside the mobile hospital as you see people come out. Or especially the day after their surgery. They take off their patch and there's because people see their and they realize that in front of the life they thought they had lost. Most of the older people we treat have cataract, and it's a very treatable disease. Some of you have been through the procedure and know that it's a remarkably successful procedure. And for someone who's blind from cataract, because in this country, not blind and needing surgery, we're just starting to get care because it's accessible to everyone. In Armenia, many of them don't get surgery until they're blind. They regain sight. And so it's incredibly inspiring to see these smiles and to get the hugs and kisses, and I get chilled at one. The other end of the age spectrum was also the most vulnerable. Babies born in Armenia, if they're unlucky to be born premature, have a visual system, the retina, that hasn't fully developed, hasn't grown. And what these children, the same thing happens in the lungs. So their lungs aren't developed, their eyes aren't developed, other parts of their nervous system are. For the lungs, they have to give them oxygen. But oxygen begins to destroy the retina, to develop a neural part of the eye, creating a disease called retinopathy and prematurity, ROP. And so because of advances in keeping these babies alive, right, that happened around 10 years ago, 12 years ago, they started to get oxygen supply so the babies didn't die, but they were growing their form. And when you are blind for retinopathy and prematurity, once it happens, there's really no cure for that type of blindness because the retina never develops. So but it's treatable and it's preventable. Not only can you manage the oxygen delivery to the child so that they're doing it in a measured way that causes less likelihood of ROP, but you can also treat it with lasers and other treatments that prevent the retina from detaching. It leads to a complex type of retina detachment. So we put in place, with the help of Tom Lee, that our meeting guy. Tom Lee devotes his life to the Armenian Project. He considers it the most important thing he does as a pediatric retina specialist in Children's Hospital in LA. He has made more trips to Armenia than I think about 20. And he is the biggest part, and he has not only done that, he's brought many other people from CHLA to Armenia to expand the pediatrics program. 5 years ago, we really fielded this program at the Center of Excellence and operating room for treating these babies. Chen Wong is another retina specialist. Wong is a good Armenian name, right? This guy's come from London. He's at the world's most, well, say England's most prestigious eye hospital, Moorfields, has made many trips, something like 25 trips to Armenia to do these complex surgeries and train the doctors there. We have remote systems so that they can watch, even while he's in the UK, he can watch a surgery being done and guide them. 500 have been treated, and we've had no child blinded from retinopathy through injury in 5 years. What was an epidemic of blindness in this case has ended, thanks to the efforts that we've made and gifts of equipment and mostly training. So, older children are also at risk. As a child develops, their eye system really doesn't fully mature until about age 10. The neural connections to the brain don't really wire in until age 10. And if they have even just a need for glasses, they don't have serious disease, they can lose functional vision in one or even both eyes. This condition called amblyopia is one along with other diseases that we screen for. And we put in place a school screening program that just didn't exist. Here in the US, we've got school screening is standardized for kids who are growing up. They get their vision tested, so they get referred for eyeglasses early enough that their visual system can develop properly. In Armenia, we have the same thing too. And we have, thanks to the help of Tom Lee, we're influencing the pediatrics, not just pediatric ophthalmology, but pediatrics residency programs so doctors understand the importance of visual screening at a young age. Made a huge impact on vision for the next year because it's a heck of a lot easier to preserve vision than it is to reverse most. Diabetes is another huge problem. You know, it's estimated in the US in a few years, a third of the population is going to be diabetic. A third of the population is going to be diabetic. It's incredible because this is a disease that is responsible for a huge amount of heart disease and hypertension and other complications that kill us as we get older. And we have the same problem in Armenia, of course. About the Armenians, we get every bad disease. With the support from the World Diabetes Foundation, so this is another reference to Jug Vegan Tube, because we've been able to get support from a lot of international organizations. And we're able to get that support because they recognize the goal that when they invest $1 in a program that the AACP puts on, that it's going to return $10 worth of benefit. And so we're a good investment for them. And so we continue to work with them on a program where we have these, and many of these cameras have been donated by companies that have a platform where you can take a patient, don't even have to dilate the eye, take a digital picture, and the phone that it's connected to has a wireless internet connection. They do have that in Armenia, it's available everywhere. It uploads the picture to the cloud, where an artificial intelligence-based system looks at the back of the eye, the retina, and grades the likelihood of diabetic disease, sort of red, yellow, green. You know, is this normal? Is this maybe fishy looking, or is this looking bad? Yellow or green gets referred to a doctor for review and potentially examine and potentially treatment. Green, you're good to go. So we do this. We've been doing this in Armenia now since about 2017. It's now 6 years. I go to conferences here in the US, and the retina specialists are talking about this work and the treatment we have. But we use this artificial intelligence-based system in diabetic clinics to screen people so that they can, you know, we can find where the disease is. And they say, isn't this exciting? I say, yeah, we've been doing this in Armenia for 6 years, man. You know all about it. So we're actually ahead of the curve. And partly the problem in the US is there's a lot of regulation that prevents it. In Armenia, we do what works, right? Jug Vegan Tube, we do what works. So, so that's in play. Strengthening regional eye care, I'm coming to the issue. is also important, because while our mobile hospital has made a big difference in the regions, it can't be everywhere all at once. And we recognize that we have to be there with an ongoing enduring presence. And so we created regional icons, 5 of them. And it's probably impossible to read the map from there, but Gyumri, Spitak, Tavush, Yeved Nazor, and Kapa are the locations of those. And of course, we have in Yerevan. And those regional clinics we've been deploying them about 1 a year since 2015, 2020. And what we've done there is instead of building a building, we work with an existing healthcare system where there's a hospital where people are used to coming. And we install equipment and put in place training. And then we have our doctors who work for the eye care project who circulate around to these clinics to do surgery when it's needed, or to use other skills in consultation that they may not have locally. So we train the local people in more advanced eye care than they were given, and then we go and treat those patients who need it on site in the region. So those who can't afford to travel or can't wait for the eye care at the local hospital to circulate the country get treatment. To follow up on this, we're creating diagnostic clinics as well. There will be 5 more of those that are coming in the next show. We're looking at raising funds for that. That's an area where we recognize that 5 is great, but 10 is better, because there's 2 million people that we need to reach in the regions, and so we believe that no individual should be not be able to access affordable eye care. Everything we do is free. The clinics that are there are affordable to those who can afford it. There's a whole system for evaluating who can afford and who cannot afford. We don't want to reinvent that. It's a fairly working system, and so it helps us identify those who are poorest. And we go beyond just the strictest level of giving away to those who are the most poor. There's many cases where people can afford to pay something and we just give their care for free, because that's the simplest. I want to finish with a video because I talked about the personal side of this. And this is about a patient. I'm going to restart this share just so that it captures the video well. You bet. How are we at time? Okay. Great. This is a patient that you're going to hear about who I first saw. I'm going to say it's it's got to be more than 10 years ago. She was a teenager then, 10 or 15 years ago as a patient. And I'll let the video tell the story, because this is the personal side of what we see and what we do in Armenia and what it means to us.
Անին որ նոր էր ծնվելուց հետո շատ ակտիվ էր, շատ աշխուժ,
շատ չարաճ երեխա էր, ինչ ասես ձեռը գցում էր.
When she was 3, she got into a bottle of bleach, and she, thinking it was a sweet drink, drank it, but it splashed when she dropped the jug, and it spilled all over her eyes.
Աչքերը փակ, իր աչքերը բաց չէր արդեն.
Աչքերը սպիտակ, ոչ մի բան չէր տենում.
And she became blind.
Տարբեր հիվանդանոցներ ենք տարել.
Ռուսաստանել եմ տարել, ընդեղ էլ օգուտ չկար.
Ինք ասում էր մամ, «Всё, ինձ մի տարեք հիվանդանոց, էլի ինչ կլինի»։ Ոչ մի բան չի փոխվել։
During most of her life, Ani was a dependent person. In Armenia, those that are blind are sort of relegated to a secondary existence.
Չեմ հաճախ է դպրոց ու տունը նստած։ Երազում էի, որ սովորական մարդու նման ես էլ մի օր կտենամ։
Հետո իմացանք, որ դրսից օգնություններ ա գալիս Ամերիկայից։
Իրանք մեզ հույս տվեցին։
When she was 14 or 15 years old, we did ketoprosthesis surgery in both eyes.
Օպերացիայից հետո աչքերը բացեցին
ու մի անգամուց տեսա ու միջև մայ չեմ հավատում, որ այդպես բան կլինի իմ հետ էլի։
She was able to see the first, second lines of the Snellen chart from 5 meters.
She looked in the faces of her parents for the first time since she was 3 years old.
Հետո քիչ-քիչ մամ հայելի կտաս ես ինձ նայեմ։
Անընդհատ չէի հավատում։ Ես ինչ չէի ճանաչում։
Այդքան տարի 2 տարեկանից մինչև 14 տարեկան հասակում երեխան տեսողություն չի ունեցել։
Ինքնուրույն հիմա արդեն ման եմ գալիս։
Դուրս ա գալիս մենակ, գնում ա Երևան մենակ, գյուղը մեջ մենակ։
Եվ պետք է մենք հաց սարքենք իրան տայինք, հիմա ինքը կարա ինքնուրույն բոլորին հաց սարքի տա։
Միշտ իր հետև ընկած էիք, ման էի գալու, բայց հիմա չէ։
She went to school. She learned to read. She learned to sew.
Շատ եմ սիրում շոր կարել։
Հեսա վարակույրները մեր ցավինքն է կարում, խաղալիքներ է կարում, իրան ուզած շորը կարում է։
Մի երեխու տեսողությունը հրաշք էր։ Հրաշք։
Չափից ուրախ եմ, դաժե սիրտս է լսում ուրախությունից։
Ուրախությունից լացս գալիս է։
Աշխարհի չափել շնորհակալ եմ այդ մարդկանցից։
Եթե իրանք չլինեին, երևի իմ երեխին բուժում չլիներ։
Դե այն ժամանակ ոչ մի ուրիշ չունեի։ Իսկ հիմա ունեմ։
And stories like Ani's are the reason I keep going back to Armenia.
Շատ շնորհակալություն եմ հայտնում իրանցից։ Իրանք շատ մեծ բան են արել։
What did the father drop? The child got into the bleach. Nobody dropped it. It was the child who got into the bleach by herself. Suddenly happened? Just like that. Yeah. And her story is not alone, as you can tell. It means a great deal to me. You saw the little child that was kissing at the end. That's my daughter, she was, when I first met this aunt, who lost her vision when she was 3. My daughter was 3. So I know exactly how long that is. Money's now 17, so it was 14 years. So it means a lot to us to have the privilege to be able to take care of people who are so incredibly valuable. And for me personally, it motivates me to continue to do everything we can, to use every dollar we can to impact more people, to use every resource we can to recruit as many people as we can, because the work we're doing is so important. So we welcome support. We've only been successful because of support from builders and doctors who come. And our website, icareproject.com, is the way to learn more about how to help us. You can donate there, sponsor a village for screening, you can contribute to a regional diagnostic clinic that is going to be open in the next couple of years, and there are many ways that you can get involved. So I thank you for your time today. It's been a pleasure to be here and everybody and see everybody. And I hope I finished on time. Okay, thank you, guys. Very well done.